Hello, good evening, everyone. Good evening, Aditi, Manovna. We'll just wait for 1 minute to let everybody join in and then we'll start. Good evening, Tanvi. So, guys, welcome to Rapid Rewind session uh, of PYQs of OMR subject. Okay, so I have curated the most important, which I think 10 to 12 questions, which are most important for your NEET MDS 2025. All right. So this is kind of a revision. So I want everybody to participate in and give your answers in the live chat. Okay. So let us start with the first question. All right. So the first PYQ is just a second. All right. So the first PYQ is the image below shows multilocular pathology. The multilocularity is caused by septae within the pathology. What is the cause of this septation? Okay, this is a last year PYQ. Okay, 2024 NEET had this PYQ, this question. Okay, so they have this multilocular pathology given, which is in the posterior mandible region, right? They are asking the septase that forms inside this multilocular pathology is due to what? Okay, what is the cause of this septation? So first is formation of new bone within the pathology. B is entrapment of normal bone within pathology. C metastatic calcification, and D none. Okay, what do you think is the answer? All right, I can see many B's. All right, yeah, correct. So option B is the correct answer. It is entrapment of normal bone within pathology. So what happens exactly is when this is a mandible and this posterior portion is affected and there is a formation of multilocular pathology over here, right? What happens is the normal bone in between this septate gets resorbed or destruction or resorption of normal bone, okay, that occurs, and these are the septae, these are the remaining normal bone within the pathology or the lesion. Okay, so what are these septation? These are just entrapment of normal bone within the pathology. Okay, rest of the normal bone gets destructed or resorbed, okay, due to particular condition, and then rest the septation which are left are nothing but the normal bone, okay, within the pathology. All right, so this is the first question that we have. All right. Question number second. Dead bone or new bone? No, it is normal bone that is remained. Not a dead bone, not a new bone. This is a normal bone that is remained after destruction of the normal bone surrounding it. Okay. The septation or septase are the normal bone remaining after the destruction of the surrounding bone due to condition, any condition. Okay. All right. So next is A 19 years old girl shows horizontally impacted third molar tooth in the mandible. Okay, there is 1.5 mm radiolucency around the crown of the tooth. Okay, so they will give you radiograph, and in the radiograph there will be a impacted tooth which will be there. Okay, impacted tooth will be there, and around this impacted tooth we have the radiolucency. That's what the question is about. Okay, now this radiolucency, now you should know the measurement, or the you can say the radiolucency around or coronal to the impacted tooth. So there is a normal follicle that can be there. There can be a hyperplastic follicle, okay, or there can be a cyst around coronal to the impacted tooth, right? So what is the measurement or diameter of the normal follicle? Normal follicle measures around 2 to 3 mm. Okay, normal follicle measures around 2 to 3 mm. Hyperplastic follicle measures less than 5 mm. Okay, and the cyst, if it is a dentigerous cyst, it will measure around greater than 5 mm. Okay, greater than 5 mm. So among the given option, what should be a correct answer here? It is nothing but a dental follicle, option number A. All right, I hope everything is clear. All right, so whenever they give the diameter within 2 to 3 mm, it is a normal follicle. If it is less than 5 mm, like between 3 mm to 5 mm, then it is a hyperplastic follicle. If it is greater than 5 mm, then it must be a cyst. All right, so it is very easy uh, question. This is also last year PYQ, so please go through it. Okay, they can ask it again, they can repeat the questions. Okay, so you must know the answer, correct answer. Moving on to the question number 3. If a well stored X-ray film is processed, what will be its appearance? Now, this is also last year PYQ, and this was asked in NEET as well as in INICT 2024. Okay, so if a well stored X-ray film is processed, okay, so for this complete statement, there is one more word they can ask you, is fresh film test. Okay, fresh film test meaning this only. If a well stored X-ray film is processed, then what will be its appearance? Okay, so the answer, correct answer for this question is option C. It's clear with a blue tint. Okay, clear with a blue tint. Now, just tell me what will be the appearance of unexposed film. What will be appearance of unexposed film? Okay, nothing. You have not processed it. Just you have taken it out from the fresh packet. Okay, and what will be its appearance? So unexposed film. Okay, anybody? Can anybody tell me what will be the appearance of unexposed film? Answer lies in the options only. Yes, it will appear cloudy with blue tint. Correct. It will appear cloudy with blue tint. So you should know uh, uh, every aspect of this question. Okay, so first possibility is the similar question they can ask if a well stored X-ray film is processed. Okay, second permutation is fresh film test will appear. Okay, as, and the options will be same. So fresh film test is also the answer for this, is also clear with blue tint. Okay, and the next is unexposed film. Unexposed film will appear cloudy with blue tint. All right. Okay, so moving on to the question number 4. Okay, let's go. For this, a female patient who is otherwise healthy visited the clinic for skin treatment. Okay, the dermatologist observed ulcers at the commissures of lips. He revealed that she had such ulcers in the past also, and it is a frequent affair. So the ulcers are painful, so they are asking which, or they are asking to diagnose the condition. Okay, so among given options, which is the correct answer over here? Option A, herpes zoster; B, recrudescent herpes simplex; C, herpangina; and D, erythema multiforme. Now here I'm going to tell you brief about all the options. How can they give permutations and combinations based on these options? Okay, they can give you image based questions also. All right, so uh, I can see some answers. Okay. All right. So let's start from here. Okay. So here I have posted some images. Okay. So first we will identify based on the images. We will diagnose the condition based on the images. They can directly give you this image. They can directly give you this image, and they will tell you diagnose the condition given in the picture. Okay. So you should be able to diagnose that. So first image, can anybody tell me which condition is given in the first picture? Which condition is given in the second picture? Okay. And I'm asking you among the options only. Okay. So answer is here only. You just have to identify the conditions based on the characteristic feature that is seen in each condition. Hmm. Chalo, first picture tells you or diagnose the condition given in first picture. Correct. First picture is herpes labialis. Okay. Herpes labialis. Herpes labialis is nothing but recurrent infection, recurrent HSV, recurrent herpes simplex. Okay. Or it is also called as recrudescent. Okay. The second picture, pic 2. Yeah. Picture 2 is which picture? Correct. It is erythema multiforme. Erythema multiforme. Okay, now how to identify this? Because the characteristic feature you see in erythema multiforme is crusting of lips. Crusting of lips. So they can give you a clinical based question, okay, based on this condition erythema multiforme, and they can give you this picture. You should directly give this answer as a erythema multiforme because the characteristic feature seen in this is crusting of lips. All right, correct. Okay, very good everyone. Now identify this picture, picture 3 and picture number 4. Picture 3, can you see, can you see the patient? This side appears abnormal, this side appears completely normal. Okay, which might be this condition? Picture number 3 and picture number 4. First, you tell me picture number 3 is which? Correct, it is herpes zoster. And how to identify herpes zoster? Whenever there is a unilateral distribution, whenever there is a, so sorry, unilateral distribution. Okay, you can see vesicles, right? Vesicles involving here only right side of the face. Okay, they can either give you intraorally also, and intraorally on hard palate there will be unilateral distribution of the vesicles. Okay, you should be able to diagnose that condition is herpes zoster. All right. Picture number 4. Picture number 4 is which picture? So I have asked from the options only. So remaining option that we have here is nothing but herpingina, right? Herpingina. Correct? So here picture number 4 is herpingina. Correct? So herpingina is nothing but a inflammation of throat. So patient will have a sore throat and pain on swallowing. Okay, so clinical based question, or they will include this sore throat and pain on swallowing, and they will put up this picture and they will ask you the condition, diagnose the condition. Okay, so herpingina is your answer. Herpingina typically occurs in children less than 10 years of age. So, this is also an important point to remember. Less than 10 years of age children, sore throat, and pain on swallowing. Okay, correct. So, here talking about this question. So, the female patient had the ulcers on the commissures of the lips. Okay, she revealed that such ulcers seen in the past also, and it is a frequent affair. Okay, what should be your answer here? Option number B, which is recrudescent herpes simplex, which is also called as herpes labialis. So herpes labialis is a secondary infection due to HSV, and this occurs uh, due to any trigger factors. So trigger factors can be fever, it can be hormonal imbalance, it can be UV rays. Okay, these are some trigger factors that triggers this recurrent infection. All right. I hope everything is clear. Moving on to question number 5. A young man with a carious molar reports with long standing mild pain and swelling with respect to tooth on buccal side. Radiograph showed new bone formation below periosteum. This condition is called as. Okay, so again, this is also easy. Okay, we have seen it multiple times, right? Okay, so young patient with carious molars, that is odontogenic infection, of course, and then there is a clue that has given there is a new bone formation below the periosteum. Okay, new bone formation below periosteum. So this is, of course, osteomyelitis. Osteomyelitis is nothing but inflammation of bone, that we all know, right? Inflammation of bone. So if there is a carious molar over here, okay, there is an infection. This infection spreads. This infection spreads in the bone. Okay, and there is an inferior border of mandible that we have, and the outer layer is periosteum, and so there is an excessive bone deposition or formation below the periosteum that they have given. Okay, so this is typical representation of one condition. The clues are young patient, periosteal reaction. Okay, now there is a reason why you can see this periosteal reaction in young patient. Okay, so in young patient what happens is the periosteum layer is loosely attached, right? Periosteum layer in young patient is loosely attached. Okay, so it is easily lifted by the inflammatory exudate. Inflammatory exudate is nothing but the infection. Okay, so inflammatory exudate. So in young patient, this periosteum layer is loosely attached, so it is easily lifted by the by the inflammatory exudate to lead to formation of this periosteal reaction. Okay, and we call this, and this periosteal reaction when takes place frequently, okay, in cyclic manner, it leads to formation of onion skin appearance. Onion skin appearance, right? And this is called as the condition Gary's osteomyelitis. Gary's osteomyelitis, which is also called as proliferative periostitis. Proliferative periostitis. Correct? So please remember the synonym also. Instead of Gary's osteomyelitis, they can use the term proliferative periostitis. Okay? Question number 5, option B is the correct answer. Moving on to, yeah, and this is the radiograph I put. You can easily appreciate the radio opaque line, parallel radio opaque line below inferior border of mandible. Correct? Parallel radio opaque line below the inferior border of mandible. So this is nothing but periosteal reaction that you can see in the Gary's osteomyelitis. All right. Moving on to question number 6 and 7. Okay, so I have put this question just to understand the difference between the conditions, okay, and how to correctly diagnose these conditions. Okay, so first is a patient complained of repeated attacks of pain in ear and the tonsillar fossa and pharyngeal area. Okay, this is characteristic of. And the second question is, a middle aged female complains of electric shock like pain in the cheek region, which occurs for 2 minutes. In between these episodes, she has no pain. This is mostly. So, first you answer for question number 6 and then you answer for question number 7. Okay? Because I have got many queries related to glossopharyngeal and the trigeminal and everything. Okay, so I've just put this questions. 7 का आंसर is C. 7 का आंसर is not option number A. That's why I've put these questions. Okay, chalo. I'll only tell you. So we have seen in the lectures that glossopharyngeal neuralgia, when we talk about glossopharyngeal neuralgia, what happens is the patient gets attack, okay, and patient will have pain in the distribution of glossopharyngeal nerve. Okay, so trigger zones are along the distribution of glossopharyngeal nerve. Okay, so patient will have pain in pharyngeal area, posterior tongue area, ear, it can refer to the ear also. Okay, and the trigger activities are swallowing. Swallowing is the primary. Chewing. Okay, these are trigger activities. So whenever you have been asked about repeated attacks of pain in ear and tonsillar area or pharyngeal area, you mark answer as glossopharyngeal neuralgia. Okay, you mark answer as a glossopharyngeal neuralgia. Moving on to question number 7. Now we have a word like electric shock like pain. Electric shock like pain. Okay, and the pain stays for 2 minutes only. Pain stays for 2 minutes, and then in between two attacks, patient is completely normal. Okay, so this is a typical representation of trigeminal neuralgia. Okay, and the trigeminal neuralgia have trigger zones around the mouth, around ella of nose, cheek region. Okay, and trigger activities are talking, eating, swallowing, shaving, washing face, everything. Okay, so I hope you understood this. Now, when you see a term as electric shock like pain, then you immediately go to the trigeminal neuralgia. All right. I hope this is clear. I hope this is clear. Okay. So, when pain in the pharyngeal area refers to ear, a patient complains of pain on swallowing, immediately mark glossopharyngeal neuralgia as correct answer. Whenever you see electric shock like pain, which stays for 2 minutes, and then again in between two attacks, patient is completely normal, there is no pain, then the answer is trigeminal neuralgia. All right. I hope this is clear, everybody. Aditi, especially trigeminal neuralgia have trigger zones. Glossopharyngeal neuralgia trigger zones are along the distribution of glossopharyngeal nerve. Okay, so only the posterior tongue, pharyngeal area, these are the trigger, you can say, areas for glossopharyngeal neuralgia. Okay, all right. Let's move on to the All right. So, question number 8, identify the anomaly shown in the radiograph. Mark my words, complex odontome and compound odontome. Please be thorough with these two entities, okay? Many a times, okay? Many a times these questions are asked, okay? So, here, can you see this blob of radio opaque mass in the posterior mandible? Okay, blob of radio opaque mass in the posterior mandible, right? What is this? What is this? Okay, again. Okay, so let me give you another picture so that you will understand. Okay, now identify this picture. What is this picture? So both pictures are about complex odontome and compound odontome, right? But which is which? That you have to answer. So here, which is this odontome and which is this odontome given in the question? Okay. So let me tell you, this radiopaque mass, blob of radiopaque mass, which is given in the question, is nothing but complex odontome. Complex odontome. Okay. So complex odontome will occur most commonly in posterior mandible. In posterior mandible. All right. And it occurs as a radiopaque mass. Okay. Big radiopaque mass. And as opposed to complex odontome, compound odontome, compound odontome, can you see these small tooth like structures like this? Small tooth like structures. Can you see this difference between the complex and compound? Whenever you see small tooth like structures which has a radio density compared to enamel dentine, okay, these is nothing but compound odontome. Compound odontome will be small tooth like structures conglomerated into one, okay, and complex odontome will be a large radiopaque mass, a single large radiopaque mass. There will not be any small tooth like structures in complex odontome. All right. And compound odontome, most common site is anterior maxilla. Most common site of compound odontome is anterior maxilla. And for complex odontome, most common site is posterior mandible. All right. So whenever you see small tooth-like structures, it is compound odontome. Whenever you see large radiopaque mass restricting the eruption of the tooth, it is complex odontome. All right. I hope it is clear. Moving on to the question number 9. Patient had reduced mouth opening and pain after trauma in the masseter muscle. Histology reveals bony calcification and fibrous tissues. What is the diagnosis? What is the diagnosis? चलो बताओ इसमें आंसर क्या होगा. Patient had a reduced mouth opening and pain after trauma to masseter muscle. Histology में what do you see is the bony calcification and fibrous tissues. Which is the correct answer here? Mm, okay. All right. So just a second. There is a technical issue. Okay, I can see many bees. Okay, so just a second, huh? Am I audible, everyone? Okay, just wait up. There is some technical issue. All right, so I'll just continue. All right, so I'll just explain you this question. Okay, so patient had reduced mouth opening and pain after trauma in the masseter muscle, and histology reveals bony calcification and fibrous tissue. Okay, so if we go to the option number A, OSMF, okay, so OSMF basically occurs due to areca nut chewing. Okay, so there is no mention of areca nut chewing. We will just rule out this option. Okay, second one is myositis ossificans. Now, if we talk about myositis ossificans, we have two types of myositis ossificans. First is localized, and second one is generalized. Okay, so localized form occurs due to any trauma to the muscle. Okay, so trauma to the muscle can occur due to any occupation, any sports. Okay, in any sports, trauma can occur to the muscle. Okay, if if we give multiple injections in muscle, this trauma can occur. Okay, so in myositis ossificans, what exactly happens is the whole muscle is not ossified. Okay, the complete muscle is not ossified, but there is a formation of these calcifications and fibrous tissues inside the muscle. Okay, so this is what is about myositis ossificans. Okay, uh when we talk about muscles of mastication, okay, muscles of mastication, and when myositis ossificans involves muscles of mastication, there will be reduced mouth opening, as they have mentioned in the question. The patient has reduced mouth opening and pain in the after trauma to the masseter muscle. So whenever there is an involvement of muscles of mastication in the myositis ossificans, we have reduced mouth opening. Okay, and most commonly involved, you can say, muscles uh, in the myositis ossificans are masseter and sternocleidomastoid. Okay, masseter and sternocleidomastoid are the most commonly involved muscles of mastication. Okay, and if we talk about mandibular block, okay, when you give inferior alveolar block to the patient, okay, and if we give multiple injections at that site, okay, most commonly affected muscles are anterior attachment of temporalis muscle, okay, and second one is a medial pterygoid. So these two muscles are at risk when we talk about mandibular block. Okay, so when the condition such as localized myositis ossificans occurs due to mandibular block, which two muscles are most commonly at risk? First is anterior attachment of temporalis muscle. Second one is the medial pterygoid. Okay, so you can just write down these two names, and radiographically what you can see, radiographically what you can see when there is a myositis ossificans is the homogeneous radio opacities in the distribution of muscle. Okay, so if I tell you the temporalis, anterior attachment of temporalis is involved, then in the OPG what you can see is the radio opaque radio opaque mass near coronoid process. Okay, in the OPG, what you can see, radio opaque mass, and it will take a shape of the muscle. Okay, this radio opaque mass will be in the shape of the muscle. Okay, that is how we will describe myositis ossificans, and the answer for this question is option B, myositis ossificans. Okay, so due to some technical issues, I cannot write. So you can just note down what I have just told you. Okay, is everything clear, everybody? Is everything clear up to now? Mm. So, as a question tells you, histology reveals calcification and fibrous tissue. Okay, so when the muscle um, uh, is traumatized due to any cause like occupational cause, uh, in sports, or due to multiple injections, okay, this localized myositis ossificans can occur. All right. Okay, so uh, clear up to now? Clear, everybody? Yes. All right. Okay, so we have completed our PYQs. I thought these PYQs are most important, and they have been asked multiple times. So I have curated this, and yeah. So if anyone has any doubt, can ask. Otherwise, we'll conclude the session. Sorry for the last minute technical issue. I hope everybody has good everybody has understood everything. All right, people. Chalo, bye. All the best for your exam and good night. Have a nice dinner and have a good sleep and study well. Bye bye.